I don't think I do anything super special other than listening, right? Like,
I mean, I think that is the super special thing, honestly, is that you're listening and you're paying attention. And I would say, like, people very often say, not only do you listen, but I never feel like she is trying to talk me out of a diagnosis or disprove me, which is something that unfortunately is so common when anyone has ADHD or autism. I think autism, there's this belief that it's very overdiagnosed, which is so inaccurate. And then the piece with ADHD is that we're med seeking. And so many people are going to psychiatrists who are saying, who told you this? Who said you're ADHD? That's not true. You're going to have to prove that. And they very frequently send them home.
Yeah.
Welcome to That's Me, the podcast where late diagnosed, high masking autistic adults tell their stories unfiltered. I'm Corey Andreas, therapist, writer, and late diagnosed autistic adult. Every episode, you'll hear from autistic people and the professionals learning alongside us. Real conversations about being misdiagnosed, misunderstood, and burned out. We're sharing our experiences with you and hoping that somewhere along the way, this helps you build a life that fits and actually start loving yourself just the way you are. This isn't what the medical world is saying. This isn't what you'll see on TV. This is real talk from real people. Real stories that might just make you say, hey, that's me. We're so glad that you're here.
Welcome back to the That's Me podcast. We are here with someone who is awesome today. Welcome, Lindsey Burd. We are so excited to have you here.
Excited to be here.
This is awesome. Well, I've been waiting for this day for a long time. We have so much to talk about. So, Lindsey Burd, how do I know you? Lindsey Burd is basically entirely responsible for the sanity of my entire caseload at this point, which is not entirely far from the truth. No, you are a psych nurse practitioner, and you work with autistic and neurodivergent clients. Is that right?
Yep.
How did you get into that?
Yeah. So I'd say probably about 70 to 80% of my clientele would identify as neurodivergent. And I think it's kind of rare to find a nurse practitioner who specializes in it, even a psychiatrist who like only specializes in it, I think is really difficult. One of the reasons why I really enjoyed nursing was because when I went to the hospital, and this is what kind of inspired me in the first place, my little sister has like a whole bunch of health issues. So that made a big impression on me. And we were in the hospital. It was like the nurses were the ones who got her to take her medicine. The nurses were the ones that like comforted me and made sure that I wasn't bored. They were the ones that were like at the bedside, like making the magic happen. And I was just like, oh my gosh, that's what I want to do when I grow up. Like, I want to be a nurse. And then have a big family history of mental health issues. Like, there's been 2 suicides in my family, and it had a really big impact on me. I was like, I really want to work in mental health. Like, after that, I was like, I want to be able to help people and get them access. So it was very inspired by kind of my own personal journey. And when I was younger, I had like this whole horrible journey that I had through the psychiatric system. So for a long time, I was like, I'm just going to be a nurse. I don't want to be a psychologist. I don't want to be a psychiatrist. Like, I just want to go the nursing route, get my degree, be done with it, and, you know, start helping people. And I ended up going to school for 8 years anyways and prescribing. So something I probably wouldn't have believed I did if I was like 12 years old. I'm like, one day you're going to prescribe these meds. I'd be like, oh, you got to be kidding me. Like, that is not happening. Yeah.
And
so
it's a
I've
long
had
road. That is a lot of education.
Yeah.
So you got into the world of psych NP. So tell us, how, for people that don't understand the distinction, what is the distinction between seeing a psychiatrist and a psych NP?
So we kind of do the same things for the most part. Diagnosing, screening. I think the big difference is the model that we use. So for NPs, we have more of a holistic approach. So a lot of us have worked in psych for a long time, so we know, like, we've seen what works, we've seen what doesn't work. We get a lot of education also in like therapy and in providing a lot of insight into like how nutrition and like overall health impacts mental health in general. So I feel like for most of us, we have a very like well-rounded background. And I think, you know, there are lots of great psychiatrists out there too, but I feel like NPs really bridge that gap because less and less people are going into psychiatry as a specialty. And now we're seeing more psych NPs who are kind of going in there. And, you know, we have, at least for me, I had a significant amount of training in like inpatient, outpatient when I was getting my fellowship done. So I feel pretty well-rounded as far as being a psych NP, and I love it. Like, it's absolutely amazing. It's incredible.
I hear from clients so frequently that they feel like they get much better care from psych NPs because they're getting more time, and they're having different kinds of discussions. So I find that often the feedback is that it feels different than seeing a psychiatrist, in that it's more personal, and they get kind of deeper in their appointments. Do you find that that's true?
Oh, yeah, definitely. I think when I worked in an outpatient hospital, I would do outpatient appointments and also do PHP. And I did notice that most of the MDs would spend about 10, 15 minutes, and there was a lot of pressure to meet that. And we would spend much longer with patients. Like, we would end up spending like a half hour, 25 minutes at least. And so the flip side of that is that you may be waiting longer for an appointment, but then the positive side of that is that you're going to get more thorough care. So I think that there are psychiatrists, especially like my collaborating psychiatrist is amazing here. And he spends a lot of time with people, and he does the therapy part too.
Yeah.
And so there are psychiatrists that do that.
100%.
But I feel like you more often see it with psych NPs just because of our background, honestly.
Yeah, and that's something that's really important. Like, I also have psychiatrists that I refer to that I think are very good, that have more of that background on neurodivergence. But I think it's always this case by case basis of, is this person going to listen? What is their model and things like that. So I noticed the big difference, the feedback that I hear from you all the time is that you do such a great job really getting to know the full person and not being meds happy, as we would call it, and that people feel like they're really getting a good assessment before they feel like, quote unquote, meds are thrown at them. So I'd love to talk a little bit about where that comes from and what it's like in the field, why people are having that experience.
I think number one, it's the pressure of like time management. So right now for my intakes, I typically schedule an hour and a half to go over an intake, just because if I know that somebody is, autistic, they're probably going to want to take longer as far as like talking about things. They're probably going to have maybe more difficulty with like verbalizing their feelings. And so I want to not make them feel rushed, and I think that in my clinical experience, I've seen other providers kind of be like, ask a question and it's like rapid fire and they're trying to get through their day. But when you've got someone who is autistic, they're going to have a harder time verbalizing feelings. So like, I feel like, going in there and just asking rapid fire questions, not like breaking the ice and like talking to them and getting to really know them and their special interests and figuring out their communication style is really important to get that full assessment. And even then it can take a little bit longer, to really have them come out of their shell, especially with younger people. So I feel like it's just so important to kind of slow down, make sure that you're getting a full assessment, make sure that you're talking about the things. And I'll ask a lot of open-ended questions. So I'll ask things like, what is your main goal for treatment? Instead of it being like, diagnosis, treatment, treatment. I kind of look at what chemical imbalance can I help this person with? Is it anxiety that's co-occurring? Is it depression? Is it, sometimes we see patients with bipolar who are on the spectrum, and it's like, okay, what are we looking at helping them with? Is it irritability? Is it the mood swings? And what kind of chemical imbalance is going to help the person be able to manage that better so that they're getting medication that's doing what they want, and there's no guarantee, right? There's no guarantee with meds. You might have to try a couple before you find a good one. But I think just having patients be able to ask questions and take that time and knowing that you've really fully like assessed everything that's going on and they feel like you understand where they're coming from. I feel like the psychological aspect is really important, because if you're given a medication and you feel like, oh, this person didn't really listen to me and they didn't really get to the heart of what the problem is, you're going to take it and think it's not going to work. And then, you know what I mean? Like, there's definitely a psychological aspect there. And I've also had experiences just in clinical experiences with patients who have come back later and told me like, hey, I think that, this was a misdiagnosis and I want to talk to you about why. One example is like earlier on in my career, before I was diagnosing autism at all, I had a patient who came in and she was like textbook BPD, right? Like was telling me that she's gone through all these really like rapid fire relationships, lots of issues, black and white thinking, splitting, just a lot of like behaviors. And she was aware of it and also a lot of risk taking behavior, but didn't meet the criteria for bipolar. Like didn't have like the staying up all night, didn't need to sleep, insomnia piece. And so I was like, I think you might have BPD. Like I didn't officially diagnose her, but I was like, that's what I'm thinking is going on. And I want to try a mood stabilizer with you. And so she came back like a month later and she was like, well, I didn't start it. And I was kind of like, what happened? Like, and normally, right, if that happens in psychiatry, a lot of psychiatrists will discharge their patients. And so I like to always ask why. Like if the patient is advocating for themselves, like I feel like, okay, I'm going to listen to you. I'm going to give you that space and that time to explain why. And she explained, she's like, I don't think this is the right diagnosis and this is why. And I talked to my therapist and they agreed. And I was like, that's great. Like, give me your therapist's information. Like, let me talk to them, And that was when I was early on in my career. And it really made an impression on me because like, it was like a younger lady. Like how scared must she have been to like come in there and be like, I didn't take it and I don't think it's the right medicine. And ended up doing great with an antidepressant and has been doing great with an antidepressant for a very long time. So that's kind of just my experiences in general have shaped how I look at medications and how I try to help solve problems for patients with medication because it's not always about disease process and then medicating it exactly when you're a nurse practitioner. You're kind of looking more holistically. Yeah,
absolutely. I'm so glad you brought up that example because that's something you and I have talked about offline too, where, BPD is one of the most common misdiagnoses for any neurodivergent woman. And I would say predominantly that's the thing that I'm hearing when they come in. They're saying, I've been diagnosed as BPD. And often it's because of the behaviors that are coming up when they're in burnout or coming up when they're having a nervous system reaction. And there are some crossover behaviors that we look for, but the difference being, the medication is drastically different for those two things. And also, so is the therapy. I know there are a lot of therapists that hear BPD and they won't accept the client or, they say, I don't work with personality disorders. So it can be very stigmatizing and, just really overwhelming, especially for a young person to hear that.
Oh, yeah. I definitely think it's way overdiagnosed. That and bipolar, and I had my own personal experience with being misdiagnosed as bipolar. And, that I think is two of the most common misdiagnoses that we see because when you think about the numbers, right, you're thinking about numbers of people who are being diagnosed with autism now. It's supposedly 1 out of 32, 1 out of 31, somewhere around there. And then you look at all the, adults who have slipped through the cracks of they develop, normally maybe didn't have developmental disabilities. Like my sister was diagnosed very young because she had developmental disabilities. They knew something was wrong. They assessed it. She also does not tend to be verbal. She is verbal at times, but mostly nonverbal. So that I think was a clue that really had them hone in on it. But, when you see women who are high masking, they are going to show up with all these, anxiety, mood swings, stuff like that. And it's not even on anyone's radar. Like they're not asking about sensory things. They're barely scraping the surface on the social stuff. And I feel like that's what ends up leading people to having the misdiagnosis. It's really important, I think, to advocate for yourself. I tell my patients, I'm like, if you don't feel comfortable talking to me, if you feel like I'm going the wrong direction, I'll get a notepad and I'm like, write it down. Just write down what you're feeling or even bring in a notepad. Sit down with your family, sit down with your spouse, write down the things that you're concerned about. Because sometimes when I see them face to face, they kind of just are like, oh, I don't know, everything's fine. And I'm like, is everything really fine? Let's look a little deeper into that. And I think that really helps, you know what I mean? Just trying to meet the patient where they are. I mean, I don't think I do anything super special other than listening, right?
I think that is the super special thing, honestly, is that you're listening and you're paying attention.
Yeah.
It's
Like,
unfortunately, it's very
huge.
unusual. And I would say, like, people very often say, not only do you listen, but another consistent piece of feedback and why I send so many people to you is that they say, I never feel like she is trying to talk me out of a diagnosis or disprove me, which is something that unfortunately is so common when anyone has ADHD or autism. I think autism, there's this belief that it's very overdiagnosed, which is so inaccurate. And then the piece with ADHD is that we're med seeking, or that people are just coming to
Yes.
you because it's trendy. And so many people are going to psychiatrists who are saying, who told you this? Who said you're ADHD? That's not true. You're going to have to prove that. And they very frequently send them home.
Yeah. Like my husband is probably one of the most ADHD people I've ever met. Like seriously, like I don't let him drive if he doesn't take his stimulant. Like it's not happening. Like I love him.
Totally
He was
get
like,
it.
it's fine if you talk about my ADHD. Like I was like, I'm going to talk about it. This is bad. I feel like as he's gotten older, it's a little bit worse. So like when I first met him, I was like, did you ever wonder if maybe you're a little on the spectrum? And he was like, no, my brother is, but I'm not. Like I
I'm
am so
definitely
not.
Yeah.
Never. And I was like, I don't know. Like
We can talk about
there's
that.
some things. Yeah. And he's also had a weird like background just like me, where he got kind of lost in like the world of psychiatry because he was having depression when he was younger and was also misdiagnosed with a lot of stuff. And so unfortunately, I think there's a lot of people who are probably still carrying the wrong diagnosis,
Big time.
and they've been on all these meds. Like that's the trend that I see is I'll have patients come to my office and they'll say, I'm on like all of these medications.
Yep.
None of them have worked for me. I've had these really weird side effects and I can't figure out how to get something to work. And I'm like, okay, well, let's look at this a different way. Like writing down all the medications or having these paradoxical reactions, which is really common.
And can you explain what that is for people who don't know what a paradoxical reaction is?
So paradoxical reaction or idiosyncratic reaction is when somebody takes, let's say, Zoloft. It's supposed to help calm you down. And they are bouncing off the walls, really anxious, feeling like their skin is crawling, right? It's an opposite reaction. Same thing with Benadryl or hydroxyzine. But for some patients who are on the spectrum, they're going to have a increased like agitation, anxiety from it, and then others are going to do fine with it. And the thing is, there's no right or wrong answer. Some also need really high doses. Some need really low doses. The best way to make sure that you're treating people is to go low and slow. Like that's my rule, is like low and slow is good, and not to change too many things at once, because I think that having somebody having a really bad reaction and then they're afraid of medications in the future, like they just don't want to take them. They're like, they don't work for me, which is not,
Absolutely.
it's not accurate. Yeah.
Yeah. And so that's often something, I know you and I have talked about this too. That's the thing that becomes so tricky as a therapist. People come in and they've had, maybe a traumatic experience or, even just a not so great experience with a prescriber. They had, maybe they tried one or two meds and had an awful experience with both of them. And then they don't want to try meds ever again. And so, you can sort of see in therapy, like we're headed to a place where you're sort of exceeding what can be done with coping. Coping skills can only get you so far if your body is dysregulated all of the time, or you're having so much trouble focusing, or you're in burnout. So I often think to myself, when you're sending somebody, whether it's the first time or the first time going back to try medication after a trauma, there's so much on the line of, if this doesn't go well, you may find that this person never again in their life tries meds. So I feel like you have such a big responsibility to get it right that first appointment. Do you feel the weight of that sometimes?
I do. And especially if someone's having a lot of like suicidal ideation, or they're really struggling, or they are even just having symptoms that they're not functioning well. Like they're not functioning the way that they need to. I've had patients who have lost multiple jobs. Like it's just like there's a lot of pressure, I think. But I also believe that medication can be something that can really help people too. It's like that, like I said, that missing piece. If their chemistry is imbalanced, it's not a flaw in character, it's a flaw in chemistry, right? Like this is something that we need to do to get you to a place where you're at a baseline where the coping skills are going to work for you. And I try to tell that to people. Like, I'm like, hey, you can try to do all the right things, but if you are super, super burned out and you can't get out of bed, and it's gotten to the point now where it's severe depression because you're having these ideations that are not good, and, you're almost catatonic, then you may need medication to get out of this and to be able to do the self-care. And that's okay. There's nothing wrong with that. Lots of people need medication. And like taking away that fear of it, you know?
It's one of those things where I think people are so nervous about it because they hear bad stories, you know, they hear feedback from other people and maybe they've had a bad experience. But what is really cool to see is when people do kind of take a chance and, you know, they try somebody new. And I think that as therapists, we have such a role in that to find people that we trust so that we make sure our clients are going somewhere safe. And then when they get there, they're like, wow, you know, this person listened to me, or they really changed the quality of my life by offering me something I couldn't get without medication.
It's so valuable. Like that was even when I was a nurse, like my background as an RN. When I first got a job as an RN, I actually applied to a psychiatric hospital that I had previously visited.
Oh my gosh.
I applied to work there because it was one of the only ones that was hiring for psych RNs that were new. And I failed the personality test. Twice.
Stop.
Twice.
No.
Twice. And now I know why. But it was like, I was just like, what's wrong with me? And then I would go there and see the people working there. And I'm like, what?
You're like, did they pass?
How did they pass? Like, what did I do wrong? But I wanted to work in psych. Like, that was what I wanted to do. And I got a job as a case manager. I applied for it, even though it said you have to have so many years experience. And like, I came in thinking like, I'm not going to get this job. Like, this is like almost a management job, like, right? Like you're doing case management. And it was for people who had severe and persistent mental illness, autism spectrum disorder, or developmental disabilities. So like, those were like the criteria of the patients that we served. And I was like, hey, you know what? Like, I've got experience with this firsthand myself, you know, not that that means that you can be a professional in it, but I was like, I came in and I was just like, I'm really interested in this. This has been my experience. Like, this is what I think I can bring to the table. And I also had management experience before I was an RN. So like, they actually took a chance on me and it was incredible. Like for 5 years, I grew that location tremendously. Like when we first started, I think we had about like maybe 50 patients that were in a clinic. And so the clinic was like, we had a psychologist, like a few different psychiatrists, and then a nurse who would find out like physical health information, like what's going on in their lives, different stressors. We would come in and have a clinic where we would like observe people, talk to them, you know, and just like make medical decisions together as a team, because just having a psychiatrist, like people who couldn't advocate for themselves very well. And it was incredible. And I loved it so much that like I kept finding more psychiatrists that I was like, hey, you know, like, are you interested in learning more about autism? Like, would you like to learn more about it? Like, why don't we come? Because the majority of patients that were on, you know, our list had autism, and so many psychiatrists didn't know how to treat them at all. We had one that retired like kind of abruptly because of health issues. And we had 35 patients, some adolescents, and I called everyone, like, and I'm talking even self-pay, like looking for anyone. No one was taking new patients, or taking clients that had autism that were adolescents. And I was like, this is wild. I've sat here and called 60 people and I'm not getting any answers, or I'm not getting responses. And everyone says we don't do autism, click. I was like, I'm just going to go back to school. Like I'm, you know, like that's what I'm going to do, because there's a need for it here. And I think that like my background helped me really see how people can have different reactions and to believe people, because I think that's a big thing, is that sometimes people be like, oh, you know, they said that they got really groggy from Boost Bar and they were like really tired and like this happened. And like other providers would be like, well, that doesn't happen with Boost Bar. Like that's extremely rare. Like I don't.
Lies.
And then it does to some people. Yeah. And 100%. I saw it myself, you know. Yep. I think that really helped. Like honestly, that background was incredible. And so when I started doing, like when I actually graduated as a nurse practitioner, I still did case management nursing, just on a smaller scale. And I immediately started working at like a hospital where we kind of saw a little bit of everything, and did a fellowship there for about 6 months. And then moved into like my private practice after that. So it's been a good journey.
I love that. Well, I'm so glad you said what you said about the sensitivity to medications, because that's something that I don't think is common knowledge in psychiatry spaces, because there's just a massive lack of information about how autistic people are responding to meds. So many people that I meet with say, oh, I took this med and they told me you can't possibly be having that reaction. And I know I am. I think in the therapy world, it's becoming more common knowledge that autistic bodies are just so much more sensitive to everything, including medication. But do you find that's trickling slowly to people who are prescribing, that awareness?
I think that there's more of an awareness that like we need to know more, right? Like I
Yeah.
think there's more people who are like, hey, I want to serve this population. It's here, obviously, but we do not see people who serve adults. Like there's no one. So
Yeah.
I'm in Florida and in Maryland, and in Maryland I get referrals from people who know me all the time who are like, please, 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 like do a second opinion assessment. Even people who got like full psychological exams that they paid thousands of dollars for, and like the only assessment they did was the AQ related to the spectrum, and like everything else is like very bare bones. And I'm like, oh gosh, like you only did the AQ.
Really need an interview.
Was like almost there.
Yeah.
It's rough. And I think finding adults who will treat, who will diagnose, like we need to have that. And I do think that a lot of people just don't know. They feel kind of like perplexed about it, or they look more at, okay, like we know depression, you take antidepressants, but they're not thinking about how being neurodivergent impacts their like neurological system and how it makes such a big difference in their everyday.
Every day.
It makes everything so much harder. And that's a big issue too with like accommodations now. Nobody wants to do accommodations. Like everyone's refusing them, and it's making it very, very hard for an entire population to be able to access the workforce, and that's not okay.
Yeah, and the big thing I see too is the difference between depression and autistic burnout, where I have prescribers coming to me, I'll work with somebody for years and I'll say, hey, this is clearly autistic burnout. And they'll say, well, I don't know anything about that. But anyway, we're going to put them on antidepressants. And I'm like, this isn't depression and it's not responding to antidepressants. And oftentimes what they respond to are anti-anxiety meds, because it really is based in anxiety. So finding someone that has that awareness of like, it may look very similar to depression. So do you see that a lot? Do you see patients coming in for autistic burnout a lot?
Oh, constantly. I've had patients where they are literally coming to me saying that like, I'm barely functioning. Like I'm missing a ton of work. I don't know why I'm upsetting my coworkers. I feel like I can't function. Like they don't understand how to give feedback to their job, that they're overwhelmed. So that's a big challenge. I see a lot of people, and then, they kind of just shut down. So they stop being social. They, their relationships fall apart. Sometimes I'll suggest doing the assessment, and people might be a little resistant at first, especially if they're ADHD and they're having, symptoms that I think, maybe it makes sense to do an assessment for this, because, of course I treat all different kinds of things. And so I see people who are kind of like, I think when they look for me and they see that I also treat autism, they're like, well, maybe I've thought about it before, but some people are even afraid to do the assessment just because I think they feel like their parents won't understand, or they feel like, other people are not going to understand their experience, or they'll be invalidated. And it happens on such a large scale that they're almost gaslit by the psychiatric community. Honestly, I've had patients come to me like just crying. I mean, literally so many, especially females, who tell me that they went to a psychiatrist and said, I think I have autism. I want to talk about this. And they were told, well, I could do the assessment for you. You'd probably be on it. But what do you want me to do about it? Like, what do you want?
What would it change? Yeah.
Yeah. Or they're like, there's no way you have, like, you've been working as a teacher for 3 years. You can't have autism. And it's like, why not?
Where does it say that? Show me that.
No, like that's not how that works.
Yeah.
Yeah.
I mean, the misinformation is rampant, and it's so discouraging and disheartening, because if you are the provider that's like, no, it's clear, it's right there in front of us. I found that a lot of providers, even when I send them my assessments with all of the details, all criteria met, all of it, they'll be like, well, she's just a social worker. What does she know? She can't diagnose. I'm like, where did you get that from? That's not accurate at all.
So we're basing it, like the ADOS, right? Or
Yeah.
MIGDIS, which I recently got. Like, I went and got the MIGDIS certification, was looking through it, and I'm like, it's made in 1989. It's obvious that it was based on when Asperger's was still a diagnosis. They were, mostly tested on men, mostly Caucasian men. We're not seeing females being represented a lot in those, like, yes, maybe they can make some updates to it, but looking through it, I'm like, is it the best assessment for everyone? Probably not,
No.
We can do better assessments. And why are we diagnosing things like ADHD? We're diagnosing bipolar. We're diagnosing borderline. That's a personality disorder, but we have no idea how to diagnose autism, and regular providers are afraid to diagnose it. Like, I don't understand that mindset, because there's criteria there. And are we just going to ignore that whole part when it's 1 in 31 people and it seriously affects their quality of life and everything? You know what I mean? Like, it's really intense. So I don't understand why so many people don't.
Right. And the thing I can't stop thinking about is I look at my caseload and I think of all the people that I am working with that are autistic, and all the people I've worked with just in private practice, let's just say just those numbers, not one of them is accounted for in any of the stats that we're hearing. So let's just say it's 1 in 31. No way, because they're not tracking adults. They're very, very infrequently tracking women or other genders. Like, this is based on the stereotypical male presentation, and we're tracking children. So that's cute. But a lot, especially females and non-male autistic people, we're not even showing a lot of the traits until middle school, high school, maybe even college, when we burn out the first time. So we have no idea how many people are autistic. And I think if we actually had figures on that, think of how many families. Like, I look at my family, I'm like, out of all of the autistic people in my family that have no idea, there's probably 2 of us that are diagnosed. Well, how many of us are not diagnosed? So that's just my family. So, and all the families that I work with are saying the same thing. Like, my dad's a little ADHD, my mom, she's borderline, she's bipolar, she's got ODD, she's got everybody will tell you this complicated, family history. And 9 times out of 10, I'm like, I really bet you that all of these things could be accounted for if we really just understood that neurocomplexity is probably a lot of these things. And it's probably autism, is the kind of umbrella thing.
Oh yeah, definitely. And I know I've learned more about PDA from you, actually, and like learning about it through, mutual clients, and just like learning more about the criteria. And I definitely think I had it when I was younger. Like, that was without a doubt what I was dealing with. So I know for me, like, ever since I was a little kid, even in kindergarten, I had almost no social skills. I was early walking, talking, potty training, all that stuff, reading actual, and not that I'm saying it to brag, but I was a weird kid. I was reading James and the Giant Peach in kindergarten in the corner, and I wasn't talking to people. I had no interest.
Hyperlexia is real. Yeah.
I had zero interest. And then when I got into 2nd grade, the bullying really got bad. And I was so scared for my kids, because I'm like, oh my gosh, they're in 2nd grade. And I always worry, because I know my youngest definitely has a lot, without a doubt, has all the traits that I had when I was younger. My older one is a little bit I'm not going to assess them because they're my kids, right? But I can see the similarities. And so it's funny, because I was so worried when I had a birthday party, and she was like, I want to invite everyone in the class because I don't want to leave anyone out. And she's the sweetest kid. And I'm like, oh my gosh, if I did that in 2nd grade, no one would have showed up. No one would have showed up. I was bullied relentlessly. I mean, I remember sitting at the playground, eating alone. And then, people would tell me I would do these socially unacceptable things all the time. I remember when I was in middle school, it was a fresh start, because I was with all new kids. There were a bunch of kids from all the different schools that were together. And so apparently I picked up my tray and sat down with the popular girls who are the popular girls. But actually, it went well, because one of them is still my best friend. So.
Wow.
And she'd always tell people, she's like, Lindsey's really shy. When you get to know her, she's really actually she's out there. She's she just explain me for
she translated for you.
Yeah. She's out there, but she's really cool. Don't worry. She's just quiet at first. So we were friends all through middle school, and I think that made it a little bit more bearable. I think the bullying kind of calmed down then, because it was more of a mix of people. But it was so funny, because at some point on the bus home, we're with the same kids that I used to, they would be mean to me and torture me throughout my entire experience of elementary school. One of the girls was like, I saw what you did, and I saw how you went and sat with the popular girls, and I'm like, what are you talking about?
Oh my God.
What why are they popular? And she's like, well, like everyone likes them and they're just popular. And I was like, the thought, like literally what sixth grader doesn't understand that? And like
Right.
looking back on it, now I've seen Clueless and like I can make references from movies. But back then I was seriously
idea.
clueless. Like
Yep.
socially
Oh
so
my gosh.
awkward.
The
And
same. I would get myself in trouble. We moved a lot, and I would somehow I would end up bullied no matter where we went. Like it happened in college. Like it happened in college where like I couldn't understand what I was doing. I was pissing people off, and like they would be like, "You're so rude," and I'm like, "What are you talking? I'm like the nicest person ever." But I was doing things that were like socially not okay. But I remember in high school, we had already moved twice, so this is literally like my third high school, which is traumatic, right? Like that's a whole
yeah,
nother thing.
it is.
It's awful. And
Yeah.
it was this tiny little school, and we go in and like somebody asked me like, do those girls like you, or do you talk to those girls? And she clearly was trying to like get a feel for me. And I was like, oh, I don't think that they like me very much. And I just started like, I'm just spitting facts. Like I'm just like, oh, they don't like me because blah, 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 blah. And so what does she do? Because it's high school. She wants to be cool. So she goes and tells them, oh, Corey said, And I was like, no, that's not what I said. Hold on. You're taking that totally out of context. But it was like, I was saying this like pathetic, sad thing. Like, oh, I don't think anybody here likes me. I haven't really met anyone that I'm close to. And she's like, Corey said that you're not this and you're not this. And they tormented me. Like
It turned it into like a mean thing.
Yes.
Yeah.
Like I was like,
Girls
I
are
wish I was
mean.
cool enough to be mean. And so they would like chase me back from lunch. They would make threats that they were going to kill me at graduation. Like looking back, I'm like, why did I go to school? Because now a lot of the kids that I work with are like, I'm not going. And I'm like, had I known that you could break a rule and just stay home, I would have been a school refuser in a second, because it was it was absolutely traumatic. And I see this in kids now. And I think that like one good thing I'm seeing is that, we have more supports for kids that are probably like what we looked like in our teen years, where I think people now, like social workers, are pulling them in, and counselors are saying like, hey, let me help you out here. Let's do a lunch bunch, or like, why don't you come eat lunch with me? Because I probably would have been a totally different person if that happened.
Yeah, I had a horrible experience. We actually did relocate when I was 16 into the DC area, and I had a horrible time because the school was really overcrowded. And when I say overcrowded, it was like a concert, like in the hallways, like overcrowded to the point where people were just shoved in, and you'd be touching people, and like for me, instant panic attack. And I just was like, I can't do it. So I'd wait till after the bell rang, and then I would go to my locker and then go to the next class. So I kept getting these like tardies. And then they were like, well, we're going to fail her because she's too many tardies. And my mom was like, what's going on? And I didn't know how to explain to them that like being pushed in like a sardine gives me a panic attack to the point where I feel like I can't breathe.
It's a nightmare. It's all the bad things. It's just every bad thing for an autistic kid in the worst time of your life, where you're like, I don't know who I am, and I don't know how these people do what they do. But I remember I would go home and say to my mom, like, how do people become popular? Like, how do they, I just don't understand. Like, what am I doing wrong? And everything was like systematic. Like, it was like everyone was wearing shark watches. And I'd be like, I guess I have to get a shark watch. Or like, everyone's wearing Gap jeans. I guess I need to have jeans from the Gap. And then I do those things, and I like quite literally would be like, Mom, it's not working. Like nobody likes me. Like they're still making fun of me. It was so awful. So I think you just tell yourself these stories about like trying to make it make sense, but I wanted none of it. I just wanted to be ignored, honestly. Like I wished nobody would see me at all. It would have been so much easier. Oh,
or just not to be picked on, or but I also think there's like the isolation factor too, because sometimes it's hard, like when you feel like you just don't fit in no matter what you do, and it's like the isolation is so awful. But I think like my entire childhood through adolescence, like if we had known about PDA back then, like I would not have gone through the experience that I went through, which was absolutely terrible, which I have my own horrible experience that I had with psychiatry, being misdiagnosed, going down the path of being prescribed medications that were very strong that I did not need, that did not help me.
That was not awesome.
Yeah.
Wow. Yeah. And the PDA thing, like we didn't, we obviously didn't know what that was. Even a couple of years ago, nobody was talking about it. And now that we understand, there's so many of these kids that are, the schools will call them school refusers and say, they won't come in. And it's like, because they can't. Like this environment is not conducive to any kind of learning for someone who feels like they're dying at the second they walk in the building. It's
Exactly.
just brutal.
And
Yeah.
there's nothing that you can give someone. Like, yes, you can give them anti-anxiety medications. Like, medication can go so far and do so many things and can help
Yeah.
people, like the beta blockers and the guanfacine and stuff that
Yeah.
help with like rejection sensitivity, dysphoria, and like the anxiety.
Yeah.
But I think when you're working in an environment where it becomes, there's a limit, right?
Yeah.
And it's just so many bad experiences one-on-one. And like, this is the thing is like, I love going to concerts. Like, concerts are great. I can go to a concert. I need to have like a 3-day rest period afterwards. Like, I get burned out. Like, I
100%.
love myself. I
Mhm.
don't want to go, and then I make myself go, and then I have fun when I go. But then I get home and I'm like, I need to just relax for like a
days.
couple of days.
Yes.
Yeah.
Can I just
Like,
tell you a
it's
story? This is so great. So last weekend we had a concert, and my husband and I love to go to concerts, but same thing. Like, it's a lot, and I don't want anybody
yeah.
touching me. Like, I'd much prefer a seat, like whatever. So we go to this concert and we walk in, and like the downstairs is like a mosh pit. And I'm like, I mean, not actually, it's just wall to wall people. We're not that cool,
Yeah,
but
but it's like
it was
a
like a
pit.
lot
Yeah.
of sardine things going on. And I'm like, oh God. So we're like looking for the nearest place we can hide. So they have this like upstairs VIP area. And I'm thinking, like, what do you have to do to get up there? So we walk up. It's $20. I was like, done and done. Take
Yeah.
my $20.
Worth
So
it.
we go up to
Yeah.
the top, right? We think we're like killing it. So we go up. We're like, look at us. I take a picture. I put it on Instagram. I'm like, killing it. Hashtag accommodations. We're so pleased with ourselves. So like, I would say 30 minutes into the concert, this very intoxicated man next to us starts talking to my husband, and he is like gone. Like, he is on another planet at this point. And he's trying to get my husband to like banter with him, and my husband is having none of it. And he's like, hey man, what's your problem? You want to have a good time? And my husband's just like, no, I don't. And he's like, this guy doesn't want to have a good time. So we literally are minding our own business, and this guy just literally starts bullying us. Like, he's just like, this guy, and he's like cursing at us. He's giving us the finger because we won't
Oh my
engage with his drunk ass.
gosh.
And I just turned to him and I was like, I feel like I'm in middle school again. I just want to go home.
Yeah, like,
And he's
what is
like
happening?
unaffected. Like, you see the difference between how he grew up in his normal ass childhood that was all healthy and he was popular and the whole thing. He was a jock and the whole thing. And
Not
I'm like,
triggering him at all.
oh God. And I'm just like, this man is making fun of us. I just want to leave. And my watch is like telling me that my nervous system is on like the lowest HRV
I
I've
would be like
ever
shaking.
seen. Seriously, it was awful. And I was just like, we gotta go. And finally we left early. I'm like, he's gonna chase us in the parking lot. And he's like, who hurt you? I'm like, everyone. And like, you
Yes.
don't understand. And he's like, this is
It
a
was
drunk dude at a
terrible.
concert, Corey. And I'm like, yeah, but he's dangerous. But like, you don't forget what that feels like. That just like, leave me alone.
No.
I didn't bother anybody. Just like, go away. It's awful.
Exactly. Like, let me live my life in peace
Yes.
and not.
Oh.
But I feel like they'll pick up on like the kids that are sensitive. And that's
Yeah.
the thing with like my youngest. Like, she's already starting to get a little bit of that where like she gets like, if something happens and it's not fair. And like, that's the thing with her. Like, everything has to be fair. If it's not fair, she gets really upset.
Yeah.
And like, she'll come to me crying and she's like, Mommy, it's not fair because like so and so did something at the park. And we're at the
Yeah.
park with our own friends. And I'm like,
Right.
okay, like, what do you think we should do in this situation? Should we do this or should we do that? Like, what do you want to
Yeah.
do? Like, I'll try and like give her choices or like kind of
Yeah.
comfort her, but it's hard. Like, it's hard to
So
know
hard.
what the right thing to do is because she has trouble with
Sweet.
that kind of stuff.
So sad too, because you like see
Yeah.
their sweet little personality and you're like, I get it. You just want things to make sense. And I want that for you. But yeah, things are not fair.
Yeah.
Oh, brutal.
Yeah,
Brutal.
it's
So
true.
what is it like for you to parent kids and watch them go through some of the things that you had to go through that were so painful?
Oh gosh. Well, my oldest daughter, luckily, like she had so many RSVPs to her birthday party. I was like, I was so touched. Like, I was like, I feel so wonderful. Like, I felt so good, like getting all the RSVPs. I was like, thank goodness that like she's not going through what I went through when I was in
Yeah.
school. My younger daughter, I just feel like the mama warrior, you know what I mean, wants to come out where it's like at the IEPs and I want to be there for her. And I know enough about it because I work with other, kids and adolescents who are dealing
Yeah.
with the same thing. And so like she's in speech therapy. She had some delays. Like she had, OT, PT. She had to
Yeah.
have help with like, even like eating, like she had trouble
Yeah.
there too. I don't know.
yeah.
Like she did great once she like figured it out, but she's had a couple of challenges and on top of that, really bad asthma. And so it's like, it's a struggle because I've thought about like, if I feel like she's experiencing what I did when I was in school, like just with like the bullying and with everything else. And like, I still to some level feel like I'm just like socially don't do that well.
Yes, same.
But I feel like if she has trouble with school like I did, like if she starts starts to really struggle with it, and it's becoming a point where, and we do fight about getting her to school sometimes, because she will be like, I don't want to wear this, I don't want to wear that, and I know it's anxiety. Like I can see it. Like she'll have, we have to plan out everything. She has to know what she's wearing. She has to know the time. She has to know this. We follow a specific thing. And then sometimes she'll still have like issues if something doesn't go right, or if things aren't right in her room, or she doesn't have like her stuffy where it needs to be. And it's like, sometimes I feel like she'll come up with reasons.
Yeah.
Seeing her have anxiety is rough. But I do think that when it comes time, I do not have any qualms about taking her into a provider and getting an assessment done.
Yeah.
And then, you know, getting her officially diagnosed, even medication, because I think if anyone's going to need it, she may. And I think that that's like a really taboo thing about like with kids, like a lot of people are like, oh, do we want meds? But I feel like if she's having trouble with her everyday functioning, like why not give her something that could help, you know, especially with ADHD too.
I've seen parents where they, you know, even different gender kids, they have different responses with meds, or it's like, you know, when you see a really hyperactive ADHD boy, it's like, no, it's a safety thing. And I'm like, it's still a safety thing with an ADHD girl. She's just beating herself up inside. She's not climbing the furniture. She's beating herself up and feeling anxious internally.
My daughter did climb the furniture though. She actually jumped off of our playset.
Oh my gosh. Really?
Yeah, she jumped off of her, she's scared of heights too. This is the funniest story. We got a new playset in our backyard. It was like a big one. I guess she like figured out how to climb up the side of the swing to get on top of the roof of the playhouse. She is the last kid I would think would do this because she's so afraid of heights. So I guess she like slid down, and her sister didn't see her do it. So she climbed up to do it again to show her sister that she could jump off of the roof and hurt herself. We went to an urgent care. I was like, if she is broken her leg and needs like pins and all this other stuff, like I'm telling my husband, like we might need to medicate her. Like this is not like a normal thing that kids this age do. Like she's 6 years old. She's jumping off of the top of like a roof.
When my kiddo was little, and this was when we were still, I don't even know if we had gotten the autism diagnosis at this point, but we had massive sensory stuff going on. And so if we went anywhere, I mean, this is from when she was 2, like we couldn't go to the movies, we couldn't go to a show, and she loved it, but she just could not control her little body. So we would finally like put her in the front row places because she could put her feet up on something. And so we went to like a show, and it was on her birthday. I think it was her 6th birthday. She put her feet up on the bar. We had this whole thing we had to do. And I was like, it's fine. You can put your feet wherever you need to. You can move, you can fidget. We had all the things. So she basically like put her feet in socks on the bar in front of us and was rocking back and forth while we watched the show in the Hippodrome in Baltimore. Next thing you know, she flips all the way around the bar. I mean, she didn't do it on purpose, but she was leaning so hard and just like, you know,
like
trying
rocking.
to stim. Like she was just helping herself out. And she flips all the way over, lands on the back of her head on concrete. And it's probably, I mean, it's multiple feet off the ground. Like she fell so far. Yikes. I panicked. Like I replay this still now. It's been forever. I scooped her up. I mean, she could have had a broken neck. Like, and I just run with her. Within like 2 minutes, she's projectile vomiting in the VIP lounge, which just happened to be right there. Sorry about that, Hippodrome. But she's puking everywhere. Gosh. Concussion, the whole thing. So we get in there and they're like, she's acting fine. And I'm like, she has a unique relationship with pain. Like, it's just because you don't know, like a paper cut, she will fall out. But she's had 3 concussions from falling out of chairs, like 3. And they'll be like, is someone at home hurting her? And I'm like, she's hurting her. It's not us.
Like no, it happens all the time to her too. Like my daughter is exactly the same way. I'm so scared that one day they're gonna knock on my door and be like, what's going on with this child? But like, no, she really does. Like she gets hurt all the time. And I think I've always thought that more is like the ADHD side, because she is very hyperactive and very, but like it's hard to know because there's the fidgeting and there's all the overlap when they're this young. And so I always find it's a challenge like at this young to like diagnose, like even when I see kids who are obviously ADHD and they're like running all over my office, it's still like, okay, they're younger. When they get older, they might be able to control it. But like with females, it's a lot more controlled fidgeting, right? It's like that kind of stuff. It's like the rocking, and it's hard to know is that, you know what I mean? Yeah, it's so rough. So,
it's wild.
It's hard.
It is. And then like sometimes with the injuries too, like she would have such a minimal reaction to things that were so terrible. And you could look at her and be like, oh, that is not good. And then, you know, we get to the ER and they're like, she's acting fine. And I'm like, I promised you she's not fine.
But she's probably, she might have a high pain tolerance.
Yeah, she does. And she would lap her brother in anything. Like, you know, she would go to the dentist, she would go to the doctor, they'd give her shots. She'd be like, that wasn't really that impressive. Like she would be talking trash to the doctor. She's like, yeah, you could do better. I'm like, oh my God, she's like, this is wild. But yeah, it is a unique experience some days.
When I was a nurse case manager, I had a patient that slipped on ice and broke their hip and like actually tried to get in their van and drive because they did not feel the pain. They
Right.
didn't feel the pain. Isn't that wild?
It is
Like,
so
I can't
wild.
imagine breaking my hip. Like well, obviously they couldn't do it because their hip was broken, but literally a fractured
Could not
hip.
drive a
And
car. Oh my
yeah,
God. Yeah.
they were like
I
trying
tell
to get
people that
in.
all the time. Like that we say to doctors, I'm like, she has a unique relationship with pain. Like, cause you don't know what
Yeah.
you're going to get. Like some days it's so over the top where she'll be like, I can't go to school. I have a paper cut. And I'm like, I mean, I don't really think we can do that. But
Yeah.
it is like, and
Yeah.
then other things just don't seem to impact her at all. So it is quite a learning experience.
No,
But
it makes sense though. It's like
yeah,
sometimes it's like it's the sensory,
yeah,
differences, right? Like just like lights can be super bright to one person and not that bad to another person, pain is the same way. It's the
yeah,
sensory changes. And it's just
100%.
it's just the way that you're made. Like you can't change it. And that's what's so
Wow.
frustrating when like you see people who are struggling, especially in a work environment or a school environment, and like the school is not willing. Like I just recently had a school that was refusing to do loop earbuds for somebody because they were like saying that like they were just confusing them with like listening to the radio and stuff. And I'm like, this is for them to
An
be able to
accommodation.
focus.
Yeah.
Yeah. Like I
Yeah.
think if I had loop earbuds, I would have probably made it a little bit longer through high
Yeah.
school. Like
Yeah.
I think a little bit longer. I don't know what to say, but yeah.
100%. But I still use it like to get through Costco trips and like concerts and stuff like that. I
Yes.
mean, they really make life so much easier. Yeah, it is really tough. The accommodations piece you mentioned before, like that none of them are being accepted anymore, and that's been a complete 180 this year. Up until 2025, most of my accommodations, without question, were getting accepted, and then all of a
Yep.
sudden, on a dime, like never again has it been accepted, and it's been really disheartening. Are you seeing the same thing?
Oh yeah, 100%. And we're having to fill out longer forms and it's taking longer for them to approve them. And then half the time they don't. And it's very frustrating because you see people who are creative, they're intelligent, they're able to bring a lot to the table and they're being pushed out because they're different. And,
Mhm.
it's like this entire population is being discriminated against and
Yeah.
it's not okay. It's like it's
Yeah.
literally happening and you see it
Mhm.
every day and it's so sad. I mean, I've had patients who have literally told me after their accommodations they were denied, they were like, I'm considering like leaving the country. Like literally, like they've considered leaving and I'm like, that's sad. It's not great that we're making people feel that way and they're having a hard time finding a job that actually will meet them in the middle, at least somewhere. And it's not that they're asking for accommodations because, they're lazy or they're
No.
trying to succeed,
Yeah, they're
but
usually the hardest workers on the team, and it's so
yes.
interesting. I've had a couple clients leave the country, and also I've seen a lot of people who have asked for what I would consider to be very, very minor accommodations, and a lot of times it's like, well, you don't need that. You seem fine. You seem fine, and I'm like, we need to really do a better job understanding invisible disabilities because you have no idea how fine somebody is by looking at them.
It's so difficult. It's so difficult. And the health issues that come along with
Yeah.
being on the spectrum too. Like
Yeah.
I have POTS, I have probably EDS. I'm not diagnosed, but like I have all like all the things.
Mhm.
And it's like with POTS even, like I used to tell myself like it's bad, but it's not that bad until I actually fainted, like fell straight in my face. And I was like, okay, I can't do work going room to room in the hospital anymore because I need to sit in a chair because
Yeah.
I'm going to fall on my face again. And like,
Yeah.
I literally had like a black eye from it. Like I was like just standing there one moment, next moment, timber,
Oh
and
my
I
gosh.
don't think people realize how intense it
Yeah.
is. Like I have to drink liquid IV every day and I have
Yep.
to like do a bunch of stuff for
Right
it.
here.
Yeah. Like
30
and
ounces every morning. Yeah.
it could be like granted I always tell myself like it could be worse like I don't have breathing issues like my daughter, like I don't have to worry
Yeah.
about a lot of these other things, but I still feel like when you're not getting accommodations like on a basic level, when employers are kind of like saying like, well, our workforce isn't going to make exceptions for anyone, it's like, is that really moving in the right direction when you think about how many people do such great things that
Yeah.
are
Yeah.
believed to be autistic or are autistic?
That piece is so sad with the accommodations. And I think like they're asking for these very reasonable things, like
Yeah.
working from home one day or being able to have an office like kind of away from other people or extended time or not, back-to-back meetings all day. And I'm thinking these are some of the brightest people you have working. I mean, the people I work with are so incredibly hardworking and bright and just have a wealth of interests and bring so much to the job. And to hear people be like, yeah, not my problem, you seem fine. I'm like, is that real? Like you said, like, is this where we're heading? It's so
Yeah.
discouraging.
Because
Yeah.
it's invisible, and people don't understand it unless they
Brutal.
have had someone who's lived through it or they lived through it
Yeah.
themselves. And I think even like, I feel like the gaslighting that happens even from, some of the psychiatric community, because I don't want to like just like say like it's all of
Yeah.
it, but like
No.
there's a good amount of the psychiatric community where I have had so many stories of patients coming to me telling me, yeah, I suggested that I might be autistic and they laughed at me, or they said, no, you're not, or they
all
said
the time.
like, I have a patient and they won't even accept it themselves. Like they've been
Yeah.
gaslit so much and it's like
Yeah.
so obvious. But their assessment that they did on them was back in, I think like 2013. And they
Wow.
were like in college, like they said hello and goodbye and they understood like a frame of reference.
Come on.
I even tried to talk to their psychologist and be like, have you actually read this assessment? Like this is old stuff. Like
Yeah.
we're not basing the diagnoses on this anymore, but because the
Yeah.
the person who did the assessment is not willing to like make an exception for that.
Update their information. Yep.
Yeah, they're like,
Yeah.
we did the assessment, like they're not on the spectrum, like this is not it. They have OCD, like it's not. And like
Ugh.
I'm seeing so many spectrum things like that are like completely causing so many issues. And I'm like, if we
Yeah.
could just like address some just lifestyle things,
Yeah.
you know what I mean? Like some coping
Yes.
skills
We
related
were
to
just
that.
talking about that. I just did a webinar the other day with Sarah Bergenfield, and she said something that I was like, yes, I'm so glad you said that first. She's like, the therapy that I do with people is quick. Like it's quicker than typical therapy. It's very practical. And I was thinking that's exactly it. Like the therapy that I do with people is so practical. We're talking about accommodating them. We're talking about building a life that fits you, understanding yourself, identity stuff, but it's not brain surgery. And the same thing with accommodations. It's like so straightforward. We need a couple things to be more comfortable in the environment, and you're going to have an employee that will do anything for you, but we make it so hard.
Yeah,
We'll
yeah.
suffer.
And they're
Yeah.
extremely loyal, almost to a fault. Like I've
Yes.
had patients get in trouble because like everyone else is breaking the rules and they won't. And like, it's like, think about it. It's like, it really is, somebody who's extremely hardworking and is very dedicated to what they do. And it's awful. I mean, it's discrimination. That's the only way you can
Yeah.
really put it. And so
Yeah.
it's hard to see that on like an everyday basis. And then people are also getting very frustrated about it. I think it's happening on just such a large scale now. Like even places like big companies that are just refusing.
Massive.
Like it's
Companies
not
that would shock you. Yeah. Companies
Yeah.
that really, really claim to care about people and are not coming through. It's overwhelming. But you know what? As hopeless as that feels, and I definitely have days where it feels awful, knowing that there are providers like you out there that have this background, that are willing to fight for their patients and are bringing their own lived experience. Like I just have to keep telling myself that we're doing the right thing. And there's only so much that we as people can do. But I think the podcast gets out there, people hear this, and I hope the takeaway is people hear, there are providers out there that will believe you, that will hear you, that will undo some of the harm that's been caused by, systems and providers before that like didn't have this information.
Yeah. I mean, and the one thing that I want to say is that like you don't have to be on the spectrum to be able to treat people who are on the spectrum either. Like I do feel like I really want to change things as far as psychiatry goes, because I want especially like nurse practitioners, psychiatrists, like people who are like the helpers, right? Like I want them to feel comfortable making medication changes. And I can't tell you how many times I've had patients where it's like, well, we can't change any medicines. Like this is what they have. Don't change it, or I've had patients where they won't accept them to the hospital because they're on the spectrum. It almost like becomes, it's like a dirty word.
Yep.
And it's an ongoing issue. And I just feel like if more people were more familiar with it, because I didn't get any training in it,
Yep.
I think it might have been like a footnote in pediatrics and that was it. We went over a developmental assessment and talked about these are the signs of early onset autism. And then that was it. And there was no talk about any other types of autism, any other, presentations. And so I think people leave med school, they don't know about it. And so like there has to be education about it, but we have to like kind of get away from this thought process of like, oh, only people who have all this extra studying and have done all this work with.
You just have to want to do better.
Yeah. Like you can learn about it and you can be able to treat people and it's just about listening. Like I think the most important thing that I do is I just give them time to be comfortable talking and listen to them and believe them, because I don't think someone's going to come to me and lie to me about having a weird side effect or something. Like if they're telling me that, I'm going to believe them,
But what you're saying is important for people to hear is that like if you're going to a provider and they're saying you can't be autistic, like take that as your green flag to go, I'm not with the right provider. Because if they don't know enough about autism now, that just means they haven't learned about it. Like if somebody came to me and started talking about addiction, I might be like, oh yeah, maybe not, maybe, I don't know. That's not my lane. And I like to think, good providers are going to say, hey, that's not my lane, but we're not there yet. So it's just kind of like, to me, I'm like, don't take it personally. Don't be gaslit. Like, don't do that. Say, okay, this person doesn't know, and I need to find somebody that does. And I think that like, I just keep saying that to people, that if people haven't caught up, that doesn't mean anything about you. It just means they don't have the information you need, and keep going. Keep going.
100%. Yeah. 100%.
Yeah.
And it's getting better. Like, I do feel like it's
it
getting
is.
better.
It is. And so we have a little bit of an announcement because we have a big project that we're working on that's coming out soon. So we have decided that we would like to make that better in the field. And so you and I are going to be collaborating in the next couple of months to release a new meds course. So do you want to talk a little bit about that so people know?
Yeah, I'm excited. I think talking about how I think there's some medications that I've seen that tend to work better for people with autism, and then just kind of like my experiences with it and like how to dose meds, how to, treat co-occurring conditions. Because obviously you don't medicate autism per se, you're medicating the co-occurring conditions, but there's not a lot of studies though, right?
Yeah.
Like, so I think important to like take everything, like look at this with like, these are the co-occurring conditions. This is what we look out for. These are the meds that have been shown to really help a lot of people. And like, these are, kind of my tricks of the trade that I've learned that have really helped people feel better. Cause like, I mean, there's nothing more rewarding than having a patient who's coming in who feels like, oh my gosh, like I can't function, I'm not doing well, and go to like, hey, I think I can do this. Like, and it's not like there's a magic pill, but there is a way that you can approach like prescribing meds for patients who are autistic that can be really, really effective. So hoping that, we can share that.
Yeah, it's been amazing to work with you so closely because I've noticed so many of the clients, not only have they just had a really positive experience after trauma medically, but they are coming in saying, I had no idea. I mean, if I could read you the long list of, I had no idea my life could feel so good. I had no idea how miserable I was until I'm not. And so it's so encouraging and rewarding to see meds be less stigmatized and for people to say, hey, I'm willing to try anything. And I think, your approach is really honest and really like you're a real human to your patients. And that's big too, because I think, if they can sit with someone who can say, hey, what's going on? What makes you worried about this? I'm not pushing anything on you. If you end up not taking anything, that's fine too. Let's just talk it through.
Yeah. I usually will be like, hey, here's what I think would help. Here's why I think it would help. And I think also asking about like, what has your experience with psychiatry been up to this point? So like not asking like, what meds have you had? How many times have you been hospitalized? Like that's important too. But like, what's your experience with psychiatry been? Because you'll find that a lot of people have had a very negative experience. I mean, I've had a very negative experience with psychiatry.
Oh my gosh, same.
Yeah. And that makes you afraid to even make that next step. So the fact that they're even coming in, you know what I mean? Like I think just putting out there that you're neuroaffirming and that you're going to be, listen to them and you're not going to doubt their experiences is huge. Like that's going to take a huge, you know what I mean? Just like fear and boundary down where they're going to be able to really tell you what's going on. And I feel like there's a lot of medicines that are underutilized in psychiatry that help tremendously with like just the physical sensations that happen when, we're overstimulated, if that makes sense.
100%. Yeah, I'm so excited for people to have this information. So our course is going to be coming out in the next couple months, and we're going to talk both about the specifics of medications that work better for autistic clients, but also the other side of it, the side for therapists to understand better, so that we're giving, the right information, and we're making sure that people know that there is an option for medication, and working through some of the trauma that's been caused and all of that. So we're super excited to launch this class. And we'll get you details on that. So in the meantime, how can people find you?
So birdmentalhealth.com, that's my main website. So I have a private practice that I practice in Florida and Maryland. I also have a TikTok, and I know I started on TikTok and I wasn't sure about starting on TikTok. Just because TikTok has a reputation, right?
Yeah.
And people can be a little bit mean on TikTok, right?
Yeah. Have they been nice
honestly,
to you?
Yes, I've had a good experience,
yeah.
but I think putting myself out there and just talking about just general information, supplements, what labs should you look for if you're having these issues, and just general information. But I also think there's a whole community, right? There's all these people that are watching this and they think that they have ADHD or they think that they have whatever. And sometimes it is, it's just quirks that doesn't make sense. But sometimes it's people talking about their lived experience that's genuine and real.
Yes.
And they're finding community. They're getting those answers there because they're not getting it from the psychiatric
100%.
community. You know what I mean? So I feel the more providers that are out there just kind of answering questions and
giving good information.
Giving out good information or not trying to sell people things, just saying hey, even if it's hey, this is a little ouchy. I give little ouchies to all of my clients. I mean, they're amazing. They're incredible.
This
many people love them.
Oh my gosh, it's so great. So for those of you listening at home, this is the ONO. It's the ouchie fidget spinner, and it is it is a game changer. It is quite pricey, I think, for what it is, but it's similar to the ouchie. The ouchies are more a plastic material, which I love, but this is metal. I mean, you could hurt somebody with this, but it is a really good ouchie stim.
Yeah, it's the endorphin release. There you go, right?
We love
it. And I've had so many clients that are they literally have not self-harmed or hit themselves or for months because they have little ouchies. They're incredible. They're so good. So I have them in my office. I have a place that 3D prints them for me that give them out to people, and I buy all of them when they get them. I'm
love it.
They're such a cool thing. So, but yeah, also Lindsey B, the Psych NP. I'm on TikTok. I'm now on Instagram. I'm working on kind of moving everything over. Yeah. But Bird Mental Health is my private practice that I'm working at. And so far it's been going
a lot
really
going on. Yes. So we have lots going on. We'll have a course coming out soon. And if people are looking to get in touch with you, then go through your website and your social media. And thank you for doing all the amazing things, both for my caseload and all the people that are listening. I so appreciate you. You are good people.
Welcome. Thank you for having me on.
Thanks so much for listening. If this episode resonated with you, please share it with someone who needs to hear it. If you'd like to hear more about high masking, late diagnosed autism, find us on Instagram at neurocorious. And if you're ready to unmask in real life with real people, check out our unmasking retreats at CoreyAndreas.com. If you're a therapist or provider who's looking to do better with your neurodivergent clients, we have online courses designed to help you get there. Check us out at CoreyAndreas.com. You can also find more content on YouTube at That's Me Pod. And if you haven't already, please subscribe wherever you listen to podcasts so you don't miss an episode. We're so glad you're here. See you next time. Quick thank you to the sponsors who make the unmasking retreats possible. They're not just logos on a page. They genuinely believe in this community. Head over to CoreyAndreas.com to learn about the retreat, meet our partners, and find out how to get involved.